Hi, everyone. It's Dr. Erin Stubblefield here with the KMC University HelpDesk. And in this episode, we talk about a topic that comes up a lot when we're analyzing billing records. Doc, I take baseline x-rays on all my patients so I can show them misalignments, but the insurance company just denied the entire E&M visit. Well, in the world of compliance, a routine imaging habit without individually clinical triggers is a direct invitation for a costly insurance payback. So we need to talk about auto-proofing your diagnostic imaging choices. Payers have drastically restricted what they consider a medically necessary X-ray in the last few years. Taking a film simply to show a patient where their spine is out of line or for general education, unfortunately, doesn't meet that standard. To safeguard your income, every single imaging order must be driven by very explicit findings from your history and physical exam. You need to document specific clinical indicators before you hit any buttons on your X-ray scene. We are talking about recent trauma, red flags for underlying pathology, structural concerns, that you verify through your physical exam. If an auditor pulls a file and finds an X-ray bill without a documented clinical rationale and a signed formal radiology interpretation report, they will deny that service and claw back that cash. So, to X-ray or not to X-ray? Well, even if you choose not to take films, document that decision. Noting that the patient did not require radiographs at the time proves your clinical reasoning and sets up a bulletproof justification if you genuinely need to look further down the road when their condition changes. Navigating this exact phraseology required to prove medical necessity for a diagnostic test can feel a little bit like a minefield. Let KMC University step in and help you understand the documentation requirements for imaging. Don't let your diagnostic protocols expose your practice and expose your bottom line to this unnecessary risk. Anchor your imaging choices in objective data, document your rationale, protect that revenue, which you all deserve. If you like this content, then follow, like, and share KMC University on all of our social media platforms for more tips and tricks from your chiropractic, reimbursement, and compliance experts.